Now let's talk something about retreatment. This is another advantage of this 3D instrument system. Since with the same instruments we can perform retreatments very efficiently with mostly no other instruments needed. Here we see two studies that have been done regarding retreatments using the XP-endo Shaper and XP-endo Finisher air instruments. The first study was done by Dr. Adam Azim et al. Adam was probably the first endodontist finding out that high speed with XP-endo Shaper works exceptionally well during retreatment. His study compares single-file rotary systems in terms of efficiency, effectiveness, and also adverse effects in endodontics retreatment. The second study was done by Dr. Gustavo et al. It shows that XP-endo Finisher air instrument optimizes the removal of root filling remnants in oval-shaped canals. Three different single-file systems were evaluated for endodontic retreatment regarding operating time, remaining gutta percha, and apical extrusion of debris. Overall, the XP-endo Shaper operated at 3000 RPM presented better performance compared with high-flex EDM and Wei-Huan Gold. The conclusion of the second study is that both supplementary approaches significantly reduce the volume of remaining root filling material from oval-shaped canals. XP-endo Finisher air removed significantly more root filling material than passive ultrasonic irrigation. None of the supplementary approaches was able to render oval-shaped canals completely free from remaining root filling material. For retreatment, we will use the same instruments we talked about earlier. There are only two differences. One is that the XP-endo Shaper rotations should be increased to 2500 RPM, and the XP-endo Finisher air, which has exactly the same shape as XP-endo Finisher, but has an ISO 13 diameter wire, so it is a bit stronger than the standard XP-endo Finisher. Here we see the more detailed clinical protocol for retreatment. As mentioned above, opening of the canal orifices is a very important step to make it easier to use the following instruments. Opening the orifices and removing a part of the coronal gutta percha is done with the DRACE 1 instrument at 1000 RPM. You can use a few drops of gutta percha solvent, but only if the gutta is very old and hard. The disadvantage for the solvent is that later you may not be able to remove the gutta percha solvent mix from the canal. Then we continue with XP-endo Shaper, and for retreatment we increase the speed to 2500 RPM. In cases of retreatment, we determine the length of the canal based on the periapical X-ray. From that length, we have to stay 2 to 3 millimeters shorter. For example, let's say that we have a canal to retreat which has a length of 20 millimeters. We need the XP-endo Shaper to mark the length at 18 or 17 millimeters and enter the canal with 2500 RPM rotations. The high speed will heat up the gutta percha in the canal, so you should use a ISO 15 manual instrument immediately to pass the apical canal section, the remaining 2 or 3 millimeters, and determine the canal length with an electronic apex locator. Rinse the canals and re-enter with XP-endo Shaper, but this time at full canal length. Rinse and repeat 15 times with XP-endo Shaper to working length. Then we rinse the canals again and we will use XP-endo Finisher air, which dedicated to retreatment. All other specifications are the same as the standard XP-endo Finisher. We use XP-endo Finisher air for 13 seconds with sodium hypochlorite, and 13 seconds with ADTA. Or if we use dual rinse, then we stay for 1 minute in the canal. Do slow in and out movements as usual. Now let's see a clinical case, retreatment of a right maxillary canine. The patient had pain during the beating, insufficient canal filling, and inadequate cleaning of especially the apical part had resulted in a symptomatic apical periodontitis. In these images, we see step by step all the procedures followed according to the protocol for retreatment. Initially, the length of the canal was determined based on the initial X-ray. Then, the cavity was opened at the location of the old filling. We marked XP-endo Shaper 2 mm shorter than the canal length and entered the canal with 2500 rpm rotation to remove the major part of the gutta percha. We rinsed the canals and used a ISO 15 manual instrument to prepare the apical 2 or 3 mm and to determine the exact length of the canal with an electronic apex locator. After that, we finally processed the canal to its full length with XP-endo Shaper to clean and shape the canal as much as possible. After removing the gutta percha and cement from the canal, we reach the phase of rinsing and activating the irrigation liquid. In this case, we use the Irriflex needle, which allows deep insertion into the canal to irrigate and clean as much as possible, especially the apical part of the root canal. Then we used XP-endo Finisher air to clean and activate the irrigation liquid. The obturation was done with warm vertical compaction method using Total Fill BC sealer. And finally, we can see here the X-rays before, during, and after treatment. It is clear that the apical part now has better and hermetic closure compared to the situation before retreatment. Finally, I want to share with you some tips and tricks about using this fantastic system. The first step is about opening the canal orifices. Remember, this step is very important, which is often overlooked, but which greatly facilitates the chemomechanical processing of the canals. So, as we said earlier, we can use BioRay 0 to prepare the coronal aspect 2 or 3 mm deep, depending on the case. For retreatment, we will use DayRays 1 because it has an active cutting tip to penetrate the gutta percha. The Glidepath is the basis for successful root canal preparation and cleaning. We suggest a ISO 15K file must go passively to working length. Passively means with no resistance at all. Generally, it is best to use K files ISO 06 to 10 first, then measure the working length. Then we can use a small rotary night-eye instrument with a small taper to speed up our treatment. Always irrigate again and check if a ISO 15K file goes to working length passively. The treatment of very narrow canals. In these cases, obviously the solution is using BioRays 0 for opening orifices and using manual instruments 06, 08 and flushing the canals a lot. That way, we will succeed to treat even narrow canals. Many times, if a ISO 8K file does not proceed, a ISO 06 can help. Very small ISO K files easily bend. It is a good idea to try 21 mm length to have more stability than with 25 mm standard length instruments. Calcified canals can be difficult to penetrate and to treat. Removal of calcification can help us the use of dual rinse mixed into our sodium hypochlorite irrigation liquid. Greatly simplifies the procedure. The next step is on how to set the working length of XP-endo Shaper. In narrow or very curved canals, it is advisable that from the normal length we mark the instrument 0.5 mm shorter due to the expansion created by the instrument in narrow canals. When the first preparation is done, we remeasure the working length with a hand instrument and then set the real working length on XP-endo Shaper for the preparation and also for the 15 times repetitions. Remember, in curved and narrow canals, the working length can get up to 0.5 mm shorter through the preparation. Laser marking on the shaft of XP-endo Shaper and Finisher should be watched. The instruments are very thin, which is good, but when we touch the reference point during use of the instrument, the rubber stop may move. If we know where the rubber stop is placed in relation to the laser marking, we can easily see if it has moved during use. When using XP-endo instruments, it is very important to have the root canal filled with liquid. The heat of the body makes XP-endo instruments expand so they have the correct shape. Your assistant should not hold the suction directly next to the canal while you are using XP-endo instruments, as this may remove irrigation liquid from the canal. We said that it is often challenging to insert the XP-endo Finisher instrument into canals, so always place a reference of your own using the stopper and its white color line on the rubber stop by pointing it in the same direction as the tip of the instrument. When inserting the tip without rotation into the canal, the tip should be facing the tooth walls and not the bifurcation. Treatment of very wide canals. In these cases, we can only use XP-endo Finisher because there we do not need to perform a mechanical preparation and to widen the canals, but we only need to clean them. XP-endo Finisher can reach up to 3 mm in a circular fashion and mechanically removed debris or biofilm. Then our irrigation liquid can work efficiently. Our obturation method with Total Fill BC Sealer greatly supports the treatment as the sealer can flow well into all areas of the canal and does not shrink. Obturation with Total Fill BC Sealer is a simple procedure. One point to remember about BC point is that all gutta-percha points have tolerances. This is why you have to try out the point without sealer first. If the point is loose, just cut off 0.5 mm and try again. If the point does not go to working length, then you should try a smaller point. A general rule: if at the beginning of the treatment a K-file ISO 15 goes to the working length immediately, try a BC point 35.04. But if the canal is smaller and a K-file ISO 15 or even 10 does not go to the working length, then normally a BC point 13.04 will fit when the preparation is finished. Remember to use the BC sealer in the application tip to cover the BC point with sealer before inserting it into the canal. The canal does not have to be super dry. BC sealer takes the humidity to set. Setting time is about 4 hours, but can be longer if there is not a lot of humidity or very thick layers of sealer. As with any sealer, if you have to re-enter into the canal, you must let the sealer set 100%, and it is safer to bring the patient back after 1 week. And finally, I want to add some additional information regarding the use of instruments. The instruments are intended for single use, but we can put them in the autoclave, sterilize them, and use them again in the same patient, for example, in another session to remove the medication. Generally, night-eye instruments used for coronal preparation, such as BioRace 0 for initial treatment or DayRace 1 for retreatment, do not bend in the canal and can be reused a few times without any risk.